Let me turn over to questions for Vietnam. I think there's a few in the chat there. Amy, regarding, I was struck by the large volume for me, straight off. When you're looking at those three hospitals and there was such a large volume in Hospital 1 versus Hospital 2 and 3, is that just because that hospital is larger, or they had a more dynamic testing program that resulted in a higher percentage of patients being tested for hepatitis?
So that hospital facility network is pretty large because it takes care of all of the southern regions. So you have many different provinces feeding into that hospital system. So the data that was collected was actually coming from 3 hospital sites in the south, but it's centralized at their data collection center. And in the south, there tends to be more cases of hepatitis that has been detected. Hospital 2 and 3, because they're public facilities, there's limitations on who's attending and who's getting the services. So private versus public issue is what we were highlighting there.
Right. Right. There was a question about Delta testing. Maybe, I don't know if this Solange may have dropped off, but did you look at anything? Is there any information about Delta testing, hepatitis Delta testing in those hospitals as you looked at hepatitis B?
In Vietnam, not yet, and we are looking into that because funding, of course, is key. And with the public hospital sites, we are also tapping into the state-sponsored health insurance, and that's a little bit of a complex system as well. But those are items that we are pushing for in terms of also encouraging people to get tested.
That's great. It could be also a question for really all 3 of the project areas, because the testing capacity was a big focus for the COVID-19 response, strengthening testing capacity for viruses for COVID-19, but some of those platforms can certainly be applied to other viruses, including hepatitis B and hepatitis C. And you mentioned the pandemic having an impact just on the study and collection of data. Do you have any knowledge? Now to ask Ghana and then ask Moldova. Was there any noticeable changes in testing capacity over the pandemic response in Vietnam?
Yeah, so in Vietnam, you saw, the influx of patients being tested for hepatitis B and C, especially in 2020. And, that was a huge impact of whether or not they could actually go to the hospital sites. Because in Vietnam, during the COVID pandemic, there was a certain time period where things were locked down, and the focus, of course, was on COVID, and the hospitals would only take those cases as priority. So there was direct effect on those patients during that time period.
Okay,